Hi, my name's Basil Mizrahi, and I'll be talking to the British Society of Occlusal Studies on achieving biomechanical and aesthetic precision in complex cases on Friday, the 11th of October. So I've been asked just via a series of questions to give you a little bit of foresight what I'll be talking to you about on that day. And the first question I've been asked is, are there any particular pearls of wisdom that delegates will be able to take home? And all I can say is, yes, there'll be many pearls of wisdom because, like most of you, I'm in full-time clinical practice, so everything I talk about is very clinically orientated. So I'm going to be showing you and talking about how to get predictable and accurate impressions, how to make good temporaries, how to take bite registrations in different kind of techniques. So you should be able to take many of the aspects I've talked about and implement them straight into your clinical practice basically the next day. Then the next question I've been asked is, from which source do you feel you've learned most about occlusion, and how early on in your career did you learn this? Well, the reality is probably in the last 5 or 10 years I've started to believe I've got a good grasp of occlusion. It's not something you learn at the beginning of your career. It's an ongoing study, but I've learned probably the most from dental technicians, and specifically a dental technician I work with in Italy, and from Janos Mako in Budapest. I did his courses, and what they taught me is how important it is to go back to the ABCs, the alphabet of occlusion, which is tooth morphology, and learning how to adjust and reshape a tooth so that you can sort of get the dots and the lines where you want. And once I understood that as a dentist I'm in control of putting the dots and the lines, not the patient, that was a huge sort of mind shift for me and gave me a lot more confidence. So I would say to the younger dentists, don't get bogged down in philosophies and don't get intimidated by all the theories and philosophies out there. Just go back to your basics, which you did learn at dental school, but I'm sure at that time it wasn't that important and most of us forgot it pretty soon. But tooth morphology, the shape of teeth, what's meant to go where, and then learn how to adjust and create those shapes and adjust an occlusion so you can make multiple dots and multiple lines where you as the dentist want them, and nothing to do with what the patient's doing. And that'll give you a good feeling of control. Then you can take lots of different philosophies. I don't buy into one specific philosophy. I just take what I want from different philosophies, knowing that I can create practically in the mouth whatever I want to implement. And then finally, what advice would I give to young dentists looking to develop their restorative skills? Well, the first thing I would say is just practice, practice, practice. Like getting good at anything, you have to practice. So I always say to dentists on my courses, just buy yourself a typhodont and practice whenever you get some free time. Take it out and practice your crown preps, practice your onlay preps. And practice, is important. And then the three things for me that I've built my practice on are balance and predictability and longevity. So balance, what I try is get a good work-life balance. That's probably the hardest thing to do. It's not always easy, especially when you're passionate about your work. But keep reminding yourself that you do have to wear two hats. You have a home life and a work life. Predictability is crucial. I think if you want to build a successful long-term practice, you need to do whatever procedure you're doing, make sure it's predictable, because it's very easy and tempting to take shortcuts. But predictability is what gives you the satisfaction and reduces your stress levels. It's no use sort of a friend showing you a technique and they say, well, look what I did here, and it took them 2 minutes. You want to know that they can do that technique, or you can do that technique and make it predictable so it works 9 out of 10 times. 5 out of 10 times is not good enough. So go for predictability. The downside of predictability is it does take long. It comes at the expense of time. To do something predictably takes longer than just to shortcut, but it pays dividends in the long run. And the last part of that triad that I said was longevity. You want to make sure that whatever procedure you do lasts long term, because that's how you start being able to justify your fees as you're longer in practice. You need to be increasing your fees, And the way you justify that is by knowing yourself and patients, understanding that whatever you're doing in their mouth will last a long time. So 3 years is not good enough. 5 years is not good enough. You want to be aiming for 5 years, 10 years, 15 years. And that's when you can start getting the confidence to put your fees up. So hopefully that's giving you a little bit of foresight what I'll be talking about, and I look forward to seeing you all on Friday the 11th. Thanks.